Hello class, my name is Jaden, and for this discussion I will be talking about time management, resiliency, and stress reduction in nursing practice. So first I want to describe the time management strategies that I use personally and find effective. So I show up to work early to look up all or most of my patients. I show up to work around 6:45 to 6:50. I have to be there at 7. And this allows me enough time to look up most of my patients, and what I'm looking at is why they're there, their orders, and seeing if they have any labs that have been resulted. And if I have questions about any of their labs or orders, I ask night shift that's there because they will likely have the answer for me. And then also I like to start giving my medications before 8 a.m. preferably. It doesn't always happen, nothing's ever set in stone, but I do that because I have a 2-hour time window to be able to give 6 patients their medications. And so starting early gives me a little bit more time with each patient. And when prioritizing which patient I see first, I check and see what their vital signs are. If they're stable or if they're crazy, then I obviously go see that patient first. Or if I don't have any crazy vital signs, I'll go to those that have asked me or told me that they are in pain, and I give them pain management. So if I don't have to see any of those patients first, I will start with my most easiest patient, and I will go in there and assess them. So that way, my patient that takes or requires a lot more care, I will go and see them last. So that way I'm able to see them and stay in there with enough time to be able to give them the care that they need, because a lot of times I have patients who have medications that are time sensitive, like Ticasing. You really should give it exactly on time, but you will have a 1-hour time window to be able to give it. But if I'm stuck in a room for 30 minutes with just one patient, that's going to mess up the timing for my medications. And one other strategy I use to save time is I like to chart while I wait for the med room. I found that if I just sit and don't do anything while I'm waiting to get into the med room, that I am scrambling a whole lot more. Next, I reviewed an evidence-based research study related to time management and stress in nursing. It is a randomized control trial conducted by Paycar et al. 2023. It examined the effects of combined time management and resilience training among nurses. The authors found that nurses who received this training experienced lower work-family conflict and improved ability to manage their job demands. Paycar et al. 2023. This supports the idea that effective time management and organization reduce stress and improve overall performance. In practice, this reinforces the importance of early planning and prioritization and flexibility during a nursing shift. Now I would like to discuss resiliency. So according to Huber 2018, resilience is defined as an ability to bounce back, page 77. Resilient nurses often demonstrate qualities such as adaptability, emotional regulation, confidence, and problem-solving skills. While some individuals may naturally possess these traits, many aspects of resilience can be developed and strengthened over time through experience, reflection, and support. Research also suggests that resilience training can improve nurses' ability to cope with stress and demanding work environment. Paycar et al. 2023. Finally, I want to address how nurse leaders can reduce stress in the workplace. Nurse leaders can help reduce stress by promoting appropriate staffing, open communication, and realistic workloads, providing emotional support, encouraging breaks, and recognizing staff contributions also improve morale. Nurses themselves can reduce work stress by using effective time management, peer support, self-care, and healthy coping strategies. Try and use the people that are around you and delegate tasks. For example, asking your charge nurse to pass meds for you while you take a minute to go get something to eat for lunch. That is one thing that does help a lot with your mental health whenever you are working. Evidence shows that combining time management with resilience helps improve nurses' well-being and job satisfaction. Paycar et al. 2023. In conclusion, time management, resilience, and supportive leadership are essential for reducing stress and promoting safe, effective nursing care. Thank you for listening.